Lovely to see you. And I was hoping to catch up with you in Adelaide in October, but the pandemic's meant that's just not going to be possible. But of course, we are going ahead with a virtual conference, and we're really looking forward to seeing you there. But perhaps before we get to the conference, how's Wales getting on in the face of the pandemic?
Well, yes, I mean, I guess we're in a position of many countries where we're in such a position of uncertainty, how life will get back to some form of normality, which may or may not closely resemble our previous normality. But I'm glad to say we have been able to make a contribution, you know, with the SAIL data bank to the efforts. We have prioritised the research that's going on with SAIL now to be able to focus on COVID-19 research. So analysts and researchers are concentrating on this, data governance experts negotiating agreements and expediting data access while still maintaining that robustness, trying to do it quickly and right at the same time, really. We have over 100 projects in planning, and 60 of these are already up and running since the beginning of April. And actually, I'm quite pleased to be able to say, you know, for the contribution we're able to make, that SAIL is seen as leading the way in the UK. And that's because of the breadth of data and the way we're set up. So we were able to respond quite quickly, which is very nice to feel we can make such a contribution. And just one other little thing is that with IJPDS, we've got a special call out for any manuscripts, whether it's research or whether it's opinion pieces, anything really to do with COVID-19. And for any of those articles, we would expedite them, and the article processing charges would be only half what they normally are.
Oh, that's really good news. So that's the International Journal of Population Data Science. And I guess people that might be interested or have something to contribute can just Google that journal if they're not familiar with it. I'm sure many people will be familiar, but I guess if people have got a project and they're not familiar with it, they can just Google IJPDS and it'll come up.
Yes, indeed, yes.
And have you been doing much of those projects you're doing? Are they mainly university research, or they're also work for governments?
Yes, a lot of them are university research, but I'm glad to say that we are also able to support the Welsh Government. The directors, David Ford and Ronan Lyons, basically offered the population data science team to support the chief medical officer in Wales. So David is leading on the aspects relating to the trusted research environment and data acquisition and access. And Ronan is the lead for the data linkage programme. And that feeds into the Welsh Government Committee, which also feeds into the UK committee, which is referred to as SAGE, its Scientific Advisory Group for Emergencies. We also have a One Wales approach with multiple agencies working together, and also being able to leverage a multi-morbidity cohort so that we can study projects looking at the differences in what's going on for people by geographic areas, population density, even within households, and also be able to look at what's happening to people who've got existing conditions, that sort of thing as well. So there's a lot going on there. We've also done some work with public engagement. I'm glad to be able to say that too. We carried out a survey, and about 1,000 people responded on the views of people on contact tracing and the use of data that's being collected during the pandemic for uses afterwards, and how people feel about that.
Oh, that's really interesting, because obviously it's really important, and I haven't heard of that sort of engagement with the community, or at least seeking to better understand what the community's views are. Certainly in Australia, there's been the linkage units around the country being very involved in the pandemic response, but I don't think it's possible that they have been engaging with their communities, but I haven't heard anything. So the findings from your research will be really important, I think. So do you think there are opportunities for international collaboration or cooperation as a result of the pandemic?
Yes, oh indeed I do. I mean, I don't know if you have a similar one or the same one as us in Australia, but in the UK there is a symptom tracking app. It's referred to as Zoe. and
Yes.
about, oh, do you have it?
I don't think we've got your app, but there is something similar
Ah,
being used here. I can't remember what it's called.
yeah. Well, we've been asked to host the symptom tracking data, and there's about 3 million people who've downloaded the app, and then it asks you to just report a little on yourself each day as to whether you have any problems or symptoms or anything like that. And we have about 100,000 people in Wales, and of course for that data we're able to link it to sale data to be able to look at symptom tracking and look at other health data, possibly look at outcomes in the future. And not just for the UK though, we've been asked to host the data for other countries that are using the Zoe app as well. So it's going to be very useful for international comparisons as a standalone data set if you just were to compare countries. But where
Yes.
it can possibly be linked, I would imagine it would be, very, very valuable data.
Well, I probably need to find out a little bit more about what's happening in Australia, because we do have an app, but I suspect it's not the one you've got, although it's quite likely that the questions being asked are quite similar.
Yes, yes, I would imagine so, yes. Yeah.
Well, let's move on now and think about the IPDLN conference. As you know, it's
Mm.
going to be a virtual conference. We're still looking to hold it in October if we can. And I'm just wondering, do you think there are any opportunities, sort of extra opportunities from having a virtual conference as opposed to having a face-to-face meeting?
Yes, do you know, I was thinking about that because, first of all, we all felt, oh, no, we can't meet, and we didn't know what was going to happen. And we looked at it as something maybe that had been lost. But on the other hand, thinking about it, I think it opens up the conference to be accessible to more people. Perhaps people who wouldn't be able to travel, particularly if it's a long journey, from UK to Perth. I think it's something like 24 hours door to door, something like that. So for people for it's a long way, or maybe where budgets are under constraints, perhaps other countries like low and middle income countries who don't normally attend, perhaps for those reasons, I think it could be a way of opening up the conference to other people, possibly expanding the membership of the network as well. So I think it can be, we can see it as a good thing, and we can see opportunities.
Yes, well, look, that's what we're hoping. And even for things like
Mm.
workshops, where sometimes in the past the conference workshops have been limited by numbers, so people sort of have that workshop experience. But when you're online, it would be easier to run it several times if you had a workshop that would work to run more than once. And if you do have a large number of people being interested, you don't really have to cut them out. So the organising committee's thinking about that as another possible benefit as well. Well, look, Kerina,
Yes.
it's been really lovely talking to you. It sounds like you're really, really busy with the COVID-19 response in Wales. And as you said, that reflects the richness of the SAIL data bank, and clearly you're contributing to the UK response, but also to a wider response involving European countries. So I think that's really, really important from a linked data point of view. So thanks very much, and we really look forward to catching up at the conference in October.
Yes. Oh, thank you very much, Merran. Lovely speaking to you.
Stay safe.
Bye. You too.